I'd like to welcome Dr. Peter Gloviczki, who is well known to everybody. He's really been one of the pioneers and one of the leaders in vascular surgery and medicine worldwide. He's been the president of multiple societies, and he really needs no introduction. He's one of the luminaries in our field. Thank you very much for doing this podcast.
Well, thank you, Dr. Ingorani, for inviting me. It's a real pleasure to talk about this symposium that is actually pretty close to my heart for multiple reasons.
So, can you tell us a little bit about the Semmelweis International Vascular Symposium that's coming up in Budapest, Hungary from May 29th to the 31st?
So this is the second time that we organize this International Vascular Symposium together with Semmelweis University, which is a now more than 250-year-old university, one of the leading institutions in Central Europe, and my alma mater, and the Frank J. Wyeth International Society. And I was involved, and I am involved very closely with the activities of the society because I was elected president of the society when we organized the first meeting, which was in 2023 in Budapest. And the main organizers obviously were the professors of Semmelweis University, the vascular surgeons, Professor Chautonyi and Severin, and of course Enrico Escher, who is the soul of the Frank Wyeth International Society and our leader. He is the General Secretary of the Society. Now, this year we are going to have Peter Lawrence involved as well, who is the current president of the Society. So, as you said before, the meeting is a 3-day meeting. It's going to take place May 29, 30, 31st in beautiful Budapest, Hungary, really one of the most beautiful cities in Europe, if not in the world.
The meeting itself has several different components that have some amazing talks, and it's really quite wide-ranging. How did you select all of these topics? You have education, you have cutting-edge technologies, you have new upcoming ideas. How did you get all these ideas and put them all together? It looks fantastic.
Well, obviously, it is a meeting of vascular specialists. It is a meeting of multiple disciplines who are involved in the treatment of patients with vascular disease. And as a vascular disease, it involves the aorta, it involves arteries, veins, lymphatics, and arterial and venous wounds. So we have a fantastic international faculty. We were able to get together really more than 40 excellent speakers, and I should say that the Frank Wyeth Society will be represented by 18 members of the society, and they will be the North American faculty. We are going to have speakers from the Mayo Clinic, from Houston, from UCLA, from NYU, and from Harvard University, just to mention a few. And of course, we are going to have great European speakers from multiple countries who are going to travel to Budapest and present. So we are really looking forward. The venue is amazing. As I said, Budapest is really beautiful. The Congress venue is also excellent. It is the basic science center of Semmelweis University with several high-quality lecture rooms that is available. We are looking forward to have a very large group of industry, vascular industry, present, and we are going to give them ample opportunity to actually participate in our lectures during the panel discussions and plenary sessions. We organize industry presentations as well.
So I wanted to go into a little more detail about that with the industry. You have some workshops that actually look really very good. They look just as good as any other meeting that I've seen with, again, new techniques, new tools. Can you mention a little bit about some of those workshops?
Yeah, you were right in that. And obviously, the mission of the Frank J. Weiss Society is education. And we focus very much on medical students, residents, vascular fellows, and young vascular surgeons. So the first of the 3 days is entirely devoted to workshops. And we have a very useful and rare workshop of cadaveric models. You know that in the United States, it is not easy to get cadavers used for surgical dissections. And fortunately, this is an advantage a little bit of Hungary, that there are still a larger number of autopsies performed than in this country. So we will be able to put on 1 or 2 days of workshop where the young surgeons and the fellows are able to perform different vascular operations on cadavers. In addition, we are going to have an exhibition and I would say a competition of among the young surgeons for a special award in surgical simulation. We have excellent models, and we have a computer-based machine learning technique where we can actually really objectively score the performance of the competitors. So I think it will be a very exciting competition. And then we have workshops on ultrasound techniques. We have workshops on endovascular procedures, and we are going to have a very special workshop on, for instance, how to use indocyanine green lymph angiography for the diagnosis of patients with lymphedema and to help microsurgical reconstructions of lymph vessels in patients with lymphedema.
It sounds like a really exciting meeting. I love the focus on education. Your last session is specifically dedicated for education and some of the challenges that we're facing worldwide with vascular surgical education. Can you briefly mention a little bit about that? Because it's I think crucial. Some of the topics are absolutely really cross borders. They really do help focus on things that are important to all of us.
Well, there is no question that there have been major changes in education in the United States and in Europe. And the number of work hours decreased, the number of open surgical procedures decreased. It is no longer acceptable that trainees learn on during real operations on patients. So I think we really have to design scenarios where we train the young vascular surgeons for vascular interventions without the risk of them hurting the patients. And I think we learned a lot from the different type of industries. And I would say, for instance, simulation. Simulation has become so important for the training of vascular surgeons. You can learn with simulation how to fly an airplane. You can learn how to win a car race. You actually can learn with simulation how to be an expert in some of the vascular procedures, and particularly those that also require the use of different type of technologies that we use now, for instance, in the treatment of venous disease. That will be very much emphasized at this meeting. Different type of non-invasive venous procedures, venous stenting, we are going to have presentations. And that's why I'm saying that this meeting is for something for everyone. Somebody who is doing arterial procedures, venous procedures, even lymphatic procedures, and whether it's done in the hospital or as an outpatient procedure, I think we will be able to have experts, and we will be able to learn from each other. So I think I'm looking forward to have a great meeting at a very stimulating atmosphere, and at a beautiful venue of Budapest.
Thank you for putting this all together. It sounds very, very exciting. It sounds like you're really pushing the envelope and really expanding the boundaries of some of these symposiums, as you always have. And thank you very much for agreeing to do this podcast.
Thank you very much, Einel, for asking me to do that.